Welcome to the Power of One. Today I'm going to be speaking with Erik Larson, the Deputy Director for the LGBT Affairs for the City of Philadelphia. And we're going to be speaking about monkeypox and how it may possibly affect the LGBTQIA plus community. Welcome to the show, Erik. Erik, let's talk about monkeypox and clear up any misinformation the media has presented to the public. Emphasize for me how the transmission of monkeypox, the monkeypox virus, is related to behaviors, not specific communities or identities.
Yeah, thank you, Melanie. I really appreciate the way that you framed this question because I think it's important the way that this is messaged. It's important to know that this is a behavior-specific transmission. Individual communities or identity groups are not inherently predisposed, to vulnerability to monkeypox. The virus is transmitted through close personal contact. It could be through kissing or cuddling or sex with someone with monkeypox. But of course, any of these activities are not limited to MSM or larger LGBTQ communities. And it's also important to know that, monkeypox is not considered an STI. There are other behavior-specific actions that one can engage in that would make them, more at risk to contracting monkeypox.
Okay, what is your biggest fear among the LGBTQIA plus community when the media keeps saying misinformation about how the monkeypox is contracted?
Yeah, that is a really good point. I think we learned a lot from our experiences during COVID-19, or as a lot of LGBTQ folks will remember the early messaging around HIV and AIDS. We know that harm accompanies labeling certain illnesses or infections as being identity specific. In the early days of COVID, we had an administration in the federal government that was using derogatory terms for a virus that really targeted AAPI communities. And then with that, we saw a spike in anti-Asian hate crimes. And so my fear is with some of the early cases, while they may have been detected in MSM or LGBTQ communities, it's important to remember that, again, anyone can contract monkeypox through their behavior. And then there's real harm that can come from stigmatizing groups of people or associating them with viral illness.
Okay. What resources are available to the public in Philadelphia?
Yeah, thank you for that question. I think that's really important in times like this. People want to know where they can go for information. I always encourage people to go to a trusted resource. I think the city of Philadelphia has done a good job on making that messaging available to the public and updating that information as we're getting new information and guidance as well. So there is a dedicated page on the city's website. So if you go to phila.gov and you look up the latest on monkeypox in Philadelphia, there is detailed information on what you can do to protect yourself, what to look for if you're experiencing symptoms, how to access testing, and also treatment if you test positive. There's also information on the city's website on eligibility for pre-exposure vaccines for those who may be at the highest risk for encountering monkeypox.
Okay, Erik, tell me something that I've seen in the news that it is now a health emergency. Monkeypox is. What is the city of Philadelphia doing? Like, what's our response now? Because I think there are some cases here in Philadelphia, correct?
Yeah, there are. So Philadelphia definitely is one of the higher concentrations of cases, not only in the Commonwealth of PA, but among large cities in the United States. So it's important to know that there is, a degree of community spread that's happening here in Philadelphia. In terms of, what resources are available for folks as we're responding as a city, I think it's important to, follow the steps in terms of the messaging around personal behavior, making sure that, what we can do as individuals to mitigate risk on our own and to our communities and loved ones, our concerns around our exposure and how to manage that and follow up after that. So if we have, been exposed, or if we're concerned that we're exposed, where we can go to access testing for that and get ourselves, connected to a test and then eventually treatment. And then again, as we continue to get more doses of vaccine and treatment available from the federal government, where you can access that as well.
Okay. What strategies are being used as far as community engagement and community partners with the city of Philadelphia? I know with COVID, there were so many doctors, if you will, who received vaccines and they wanted to be able to provide that to the public. Do you see that same thing happening with monkeypox and the monkeypox vaccine?
Yeah, I will say this. Again, I keep referencing COVID because, we have certainly learned both from successes and missteps during COVID era. So we're trying to put those into practice in real time here as we're managing the outbreak of monkeypox in the city. We have been really intentional about our community engagement. So for starters, my office in LGBT affairs has been working in lockstep with public health from the beginning to make sure that we are, being consistent with our messaging and that it's being disseminated out into the communities where, we saw early spread. To that end, we have worked closely with local community healthcare providers, ones that certainly have a higher concentration of patients who identify as MSM or within the LGBTQ community. And that's actually where we've started distributing vaccine doses and treatment availability as well. So at this time, we have a number of community partners: Penn Medicine, Presbyterian Hospital, Philly Fight, the Mazzoni Center, Drexel, that we have made vaccine available for them to be able to work with their existing patients to make sure that we get some of the folks who are sort of at the highest risk for exposure right now connected with treatment and vaccine.
Okay. So, Erik, I want you to slow walk me through treatment for monkeypox in the city of Philadelphia. And will the city actually look at other states that are providing vaccines to, like you said, when we go back to COVID, you learn what works and what does not work. So slow walk me through treatment in the city of Philadelphia and maybe how it may differ from other cities or other states.
Yeah, that's a great question. I really appreciate it. So one of the things that we have certainly learned from looking at how other cities have handled this is we want to be really targeted with our response, especially while, we have the number of cases that we have here in the city. So while there is, I would say, a significant number of cases in Philadelphia, it's not to the level where we're seeing, thousands and thousands of community spread to this point. And so we want to be really targeted with the limited amount of, vaccine and treatment that we have available. So somewhere where we've seen sort of misstep, I would say, in other major US cities is just open availability to anybody who has the time to stand in line or who has the internet savvy to, navigate a complicated app or website, because there's real equity concerns around that. We've seen that. I'm remiss to call out other large cities by name, but there have been other large cities where we've seen, a very, very limited supply of vaccine dosage that gets eaten up by, maybe some folks who are not necessarily the most at risk at this time, but because they had, the opportunity to spend hours standing in line in the middle of the day, or because they know how to navigate a complicated website, whereas other folks, don't have access to that. So we wanted to be really intentional here in Philadelphia with how we're getting doses to people, especially while they're so limited. So right now, what we're working with is, being very intentional about contact tracing of known cases so that people who are, at the highest risk and highest need for treatment are the people that we know already, have tested positive for monkeypox and their close contacts that they've self-identified. So again, contact tracing, learning from our experiences with COVID. And then following that, as we continue to expand our vaccine stockpile in Philadelphia and our dosage that becomes available to us, how we get that to, the next level, which is community members who may not necessarily have been exposed, but through, certain behavior practices or, risk factors, those folks, and how we get them connected. So that's sort of the phase that we're in now. The public health department has a phone number where folks, if they've not been contacted through contact tracing or a known exposure, is if they self-identify as someone who is at high risk, they can call the health department, which is 5488, and they can call that number, and then those folks will help them go through a screener, make sure that they are eligible, and then get them connected to, free vaccine and treatment.
When monkeypox first became an alarming issue for the city of Philadelphia, how does that come across your desk?
Yeah, that's a great question. So my role within the city government is to both represent the needs and concerns of LGBTQ plus Philadelphians within the city government, and then also make sure that LGBTQ plus Philadelphians have access to government resources. So being the conduit between those two groups and communities is literally my job. And so on a personal note, anecdotally, I had seen plenty of my peers and community members, sharing their concerns, especially folks in other large cities, in the US where there had been community spread and exposure, kind of prior to it arriving here in Philadelphia. And I was just aware that there was a real concern. People were hungry for information. They didn't really know what treatment even looked like, let alone where they could go for it, or what even to look for if they had been exposed. What should they be concerned about, a new bump or rash or something on their body? So I started raising the alarm about this months ago with public health, and I was very glad to know that public health was well aware of it. And so that's when we started connecting several months ago about what we can do to make sure that we're being intentional, focused, and targeted with the groups that may be most at risk right now, but also being really intentional with the messaging that we're not stigmatizing individual groups or communities of people. So it is a challenge, I think, sometimes to thread that needle because, there's so much information out there. People get their sources all over the place, in this age of media technology and, the internet, social media, whatnot. So our role as the government is to try and be as clear and concise with people, to deliver information to them in a way that is accessible and, meeting people where they're at. So we've been really focused on making sure that we're doing that both within my office in LGBT affairs, but also from a public health perspective.
And you brought up a very good point. People receive information from all over the place, and most of the time it's incorrect. What is your biggest fear with hate crimes against the LGBTQ community? And are there any preventative methods that the city is taking? Because we know, going back to COVID, how so many of the Asians were targeted because of the mismessaging. So is there preventative measures in place for the LGBTQ community?
Yeah, that's a great question. I will say the biggest thing that we can do, especially from where I sit, in city government, is we have to be really, really careful and concise and clear with the messaging. Again, just because some, specific group of individuals were the first place where an outbreak was seen, or we've seen community spread there, does not mean that that group of individuals is predisposed to illness, that, they are carriers of illness, or that, they should be avoided or anything like that. I think it's really important that we, isolate the two, things here. It's like, yes, this is a community where this is happening, but also this can happen in any community. It could have happened in any congregate setting or around any group of community members or individuals. So we've been really, really intentional with messaging to say, yes, you are correct. You have heard that, there are cases spreading in MSM LGBTQ communities. And also, it is not specific to those communities. It could happen to anybody. Everyone, is at risk based on their behavior and the way that they, interact in the world. So I think it's important for us to be very, very clear with the messaging throughout and do our part to, strike down any misinformation that we're hearing elsewhere out in the world. And people know that they can come to us, to answer questions and have, real and clear fact-based information for them.
Do you think there will be testing sites for monkeypox like it was for the COVID-19 virus?
Yeah, that's a great question. I am remiss to predict the future, and I hope that we're able to mitigate, community spread as best as we can, where this doesn't scale up to the scale that COVID-19 has become. But what I will say is, I trust our public health department and our leaders in public health and their coordination with the federal government to make sure that, while we are still in this phase with monkeypox, that folks who are exposed or concerned about exposure are able to access the testing that they need. Testing is now available at the major commercial labs now. So your LabCorp, your Quest, those kind of places all have monkeypox testing available. So the wide availability of that is definitely an important point to consider. And, tests are covered through Medicaid. People can get tests, through the public health department, or again, through those listed providers that I was saying about before, where we've already seen kind of a concentration in community. So I have faith that, from our experience thus far, we have been really intentional about getting those out in the community. And if we need to scale up, then we'll make that happen.
So Erik, what message do you have for all the viewers about monkeypox and about getting correct information?
Yeah, that is a great question. So I will say, while social media is a very important tool to stay connected to loved ones and family and friends, make sure that, if you're following information that you see on social media, that it is coming from, a legitimate, trusted source. So, a lot of these community healthcare providers that I mentioned, they have their own social media pages, and those, the information that's coming from them is coming from doctors and medical professionals. Same thing with us at phila.gov on our website or our social media channels. That is led by science, medical professionals, people who work in the field and know this, back and forth. So I think that it's really important that, you are going to places that are legitimate, that are going to share factual information, and not, what your cousin, your aunt, like whatever, are saying on Facebook.
Okay, I agree 100%. Please give that important number again that people can call if they have questions about monkeypox. And does your office take calls in relation to anything that you think would be helpful?
Sure, that's a good question. So I will say, on a general level, LGBT Affairs is here to liaise with any aspect of, the municipal government here in Philadelphia, and any LGBTQ community member or their allies that have questions. So yes, any and all ways that we can help support people and get them connected to resources, please contact our office. So LGBT Affairs phone number is 215-686-0330, or you can tag us on social media. We're at Philly LGBT Gov on everything, Twitter, Facebook, Instagram, or you could find us on phila.gov. And if you want to contact the public health department because you're concerned about exposure, or you have questions about vaccine eligibility, you can call them at 215-685-5488.
Thank you so much, Erik. And I do believe education is key. Correct education is key. So much is spread through social media, which is incorrect, and it can hurt a lot of people a lot of times. So I want to thank you so much for educating the public on monkeypox and what the city of Philadelphia is doing. Thank you so much for joining me today.
Thank you, Melanie. It's my pleasure.
Thank you so much for joining me today. It is very important that you educate yourself on monkeypox, and we have to remember that we must spread love and not hate. Education is key. Thank you for joining me today. Peace and love.